Thank you, Rupa, for having us all here today. Today, we are going to discuss You Are What You Eat, the gut microbiome from a dietary perspective. Let's begin. We're going to start today with the question of which diet is best. And this is a question that your patients are considering. They are talking about this with their friends and family, and they probably have questions for you. So they probably come into your office, I know that they do, asking you which diet is best. So how can we best answer this question? We would certainly consider to objectively evaluate diet. The question of what is the best diet is out there, and there are many individuals advocating for their dietary choices, whether it's vegan, ketogenic, carnivore, Mediterranean, low FODMAP, or standard American diet. Even there is some individuals advocating for standard American diets. And some of these diets, it seems that one of the tenets is that you need to actually profess this diet and get other people to do it. People feel very attached to their diet. And we want to understand that as clinicians, we can take a objective evidence-based approach and understand that many of these diets are actually supported by little rigorous scientific evidence. So what I propose today is that we discuss evaluating evidence-based markers, such as markers that we know are associated with health of not only the colon, but with human physiology. So these markers that we're evaluating in the colon do connect to health outcomes. The markers that we can look at would be microbiome abundance and diversity, short chain fatty acids. These are the microbial mediators. They actually connect what's going on in the gut to systemic physiology via the vagus nerve. So what happens in the gut does not stay in the gut. Thank you, vagus. And then inflammatory markers, because we know that so many health outcomes are linked to inflammation, and that inflammatory pathophysiology can take root in the gut microbiome. And immunology markers, because the immune system we know lies in the colon as well. So when we take a look at these markers, we can really understand the influence of diet and health outcomes. So what diets should we look at today? And I have put together some cases of diets that are popular right now, and you will likely see these in your practice. And so that's what we're going to look at today. And hopefully these can help you understand the influence of these diets on the gut microbiome and systemic physiology. Our first diet would be the Westernized diet or standard American diet. We'll look at vegan diet, which is very popular, ketogenic diet, and the emerging carnivore diet. This is very popular. I had a pediatric patient the other day state that he wanted to do the carnivore diet. So that's gaining in popularity. And then the GLP-1 receptor agonist influenced diet. This isn't a defined diet as of yet, but I know you have patients in your practice that are on these medications, and it does influence individuals' diets. So we'll take a look at that. And last but not least, we'll look at the Mediterranean diet. Our first evaluation will be of the Westernized diet or the standard American diet. This dietary pattern is characterized by an excess of carbohydrates and fats. Generally, the profile is going to be seed oils, which tend to be inflammatory, omega-6. There's a lot of processed food in this diet. So evaluations of individuals on standard American diet have noted that processed food is really where individuals get the bulk of their nutritional, their macro and micronutrients. Standard American diet also has low diversity of foods, so food items are frequently repeated. There's low nutrient intake and fiber intake. So there's really a excess of carbs and seed oils, etc., and fat, and there's a deficiency in fiber and nutrients. Eating hygiene does play a role as well, because the way that we actually sit down and chew our food influences digestion and absorption. And it's no surprise that when there's low diversity of food, this diet has been observed to be associated with low gut microbiome diversity. And we'll talk about the importance of that. Now, Hippocrates, the father of medicine, stated all disease begins in the gut. And while we know that is not exactly true, we do know that chronic metabolic diseases take root in the gut microbiome. And that's what we're seeing in the majority of the American population is the development of chronic non-communicable diseases. There's a direct connection between these dietary patterns and chronic non-communicable diseases. And we do see that there's increase in diagnoses of cancer, diabetes, type 2 diabetes, obesity, asthma, allergies, neurodevelopmental disorders, autoimmunity, and inflammatory bowel conditions. So there's definitely in literature a direct connection between this dietary pattern and then the influence of physiology that largely takes root in the gut microbiome, and then the development of non-communicable diseases. So our first case here is going to be a young individual. This is a 27-year-old male on the standard American diet. This individual has a fasting glucose of 110, denies GI symptoms, yet when we get into that, the details are 0 to 1 bowel movements per day. This individual has the pattern of sitting and using the phone on the toilet, so spends a large amount of time in there, and eats the standard American diet. So this individual often will skip breakfast or have a muffin, having fast food for lunch. Snacks are going to be chips, fast food for dinner, and soda pop is going to be the drink of choice. We're going to take a look at this individual's microbiome via these biomarkers. Now, before we do that, let's take a minute to orient ourselves to this data set here. The first piece of information that we have is going to be the web. This web represents the patient's microbiome superimposed on the normal biotic reference range organized by phyla. This is important because these broad phyla groups of bacteria are associated with the composition of our gut microbiome and, of course, physiology and health, not only of the colon, but systemic physiology. Here we have the 6 main phyla: Bacteroides, Actinobacteria, Verruca microbiota, Mycoplasmata, Proteobacteria, and Firmicutes. We have these organized, and then you have the patient's microbiome, which is that white web there. The perfect result would be that white web is going to be superimposed on the green hexagon. That is the normal biotic reference range. When we look at this hexagon here, this individual's results, we can see that abundance appears to be adequate, and that white surface area is comparable to what we would see if it's organized on that green hexagon there. So abundance looks healthy, but diversity does not look healthy because we're not seeing a perfect hexagon. We're seeing like a squished hexagon here. And so that's moderate diversity. Now, when you look at these results, you'll be surprised to see even a triangle, a square. The microbiome can do its own unique thing because, again, it's unique to this individual. So at first glance, we can see abundance is moderate for this individual. Diversity is perturbed. Now, when we take a look at these specific phyla, that top phyla, Actinobacteria, it's pulled in. So that means that phyla is lower. We know that group likes vegetables. So here's a need to increase vegetable consumption. The top right corner, Verruca microbiota, we know that phyla likes polyphenols. So this shows a need to increase polyphenol consumption. Mycoplasmata is within range, but then the Proteobacteria is pulled down towards that. And that means that it's higher. This is important because this group, when it's outside the reference range, associated with inflammation. These bacteria also do thrive on excess fats and excess protein, which is characteristic of a standard American diet. And then we see a Firmicutes Bacteroides imbalance. And so that's largely to do with fiber and maybe some metabolic considerations there. So what we see here is that we see that this web is low in some main phyla and it's skewed towards the Proteobacteria. And that tends to be an inflammatory profile. Of note as well, the higher Proteobacteria have been associated with IBS and IBD. Now, the next piece of information we have is the dysbiosis index and diversity score. The dysbiosis index tells us how closely the microbiome is with regards to a healthy, normal biotic microbiome or how far away it is. Scores of 1 and 2 are healthy microbiome, 3 is moderate, and then 4 and 5 are dysbiotic. A dysbiotic microbiome is associated with IBS, IBD, obesity, diabetes. And so we see that this score is 5. So this patient has a dysbiotic microbiome. The next piece of information is we have diversity. Again, diversity is important with systemic health outcomes. Microbiome diversity is generally associated with positive health outcomes because you want a healthy, diverse microbiome similar to any ecosystem. So if you were going to go for a walk in your local park, you'd like to see flowers and trees and plants of all variety. That would be a highly diverse ecosystem. If there was maybe just one type of grass, that would be an unhealthy ecosystem. So diversity of the microbiome is similar. So the higher score is healthier, scores of 4 and 5. In this case, we have a score of 3. That makes sense because we saw that in the web. So for this individual, we have a dysbiotic gut, moderate diversity. Then the next piece of information we have is going to be the GI health markers. So these GI health markers are associated with health outcomes, and these are summaries of specific groups of bacteria. So first we looked at the bacteria by phyla. Then we looked at the bacteria via dysbiosis and diversity, which are well-established biomarkers. And then we look at the GI health markers, that's groups of bacteria that work together. The first group is bacteria that secrete butyrate, because butyrate is very healthy for the microbiome and physiology. Then we're looking at the gut barrier protected bacteria, because intestinal permeability is so important for physiology. And then the next group is the intestinal health marker. That is a group of bacteria that's positively associated with health. And then the pro-inflammatory bacteria. We saw that the proteobacteria, those inflammatory bacteria, are too high. Last but not least, we're looking at the balance between the opportunistic versus those barrier protective. And so for this patient, as the toggle is yellow, that indicates that these are all outside the reference interval. So therefore, this means that all of these health markers are outside the reference interval. Additional findings, we see that the short-chain fatty acid acetate is too high, the pH is too low, and the beta-glucuronidase is too low. So let's continue taking a look at that. With regards to these key findings, the acetate being too high, we find this associated with the standard American diet and the lower butyrate producing bacteria, because the short chain fatty acids are a byproduct of the bacterial makeup. This pH is too low, but that makes sense because it's a very acidic diet. And a lot of times in the standard American diet, you're consuming large amounts of dairy, and that can be associated with this pH acidic diet. And that low beta-glucuronidase is an incidental finding. We know that it's associated with low microbiome diversity, but it's not a clinically actionable item. Taking a greater look at the microbiome and the details of the bacteria. You see the phyla listed in bold here, and then we have the detailed bacteria. We see that actinobacteria, actinomycetes, and bifidobacterium are low. This is important because these are bacteria are associated with vitamin metabolism and glucose metabolism and energy homeostasis. So when they're lower, those are potentially perturbed functions in human physiology. To support these, we want to add vegetables and polyphenols because those are going to support the populations of those bacteria. Further on, we can see that bacteria that are associated with excess animal fats and proteins are higher for this individual, such as the allocytes. And then the Bacteroides pectinophilus for this individual is associated with the biomarkers of insulin resistance and dyslipidemia. So we can see that is too low because there's that inverse association there. So there's a metabolic profile here for the microbiome. And then that higher Bacteroides fragilis may help with preventing inflammation. Continuing on, we can see that additional bacteria associated with mucosal barrier integrity and postprandial appetite suppression and normoglycemia, such as that Clostridium methylpotensum, are lower. So this individual may not feel full after eating, akin to leptin resistance. We can also see that the bacteria that are lower, such as the Aranobacterium howlei, it decreases when patients have excess protein in their diet. This is important because this bacteria secretes butyrate. So excess protein will potentially decrease this bacteria, and that will potentially lead to lower butyrate, and that will potentially lead to inflammation. So we can see how there's a pathogenesis here associated with diet, bacteria, and systemic physiology. Of note, there's low fecal bacterium protenitzii, and that bacteria really likes soluble fiber, which is devoid in the standard American diet. That's important because this bacterium is very anti-inflammatory, so you want this bacteria in the colon. The Facilolarcal bacterium is elevated for this patient, and it's associated with acetate production, and it's actually associated with depression. The elevated Meranococcus navis produces acetate. So you can see here how that microbiome is associated with that health outcome. Of note, higher levels of this bacterium have been associated with metabolic associated steatic liver disease. So there's a connection with that metabolic consideration there. Moving on this last page here, we see that there's very high proteobacteria. Again, those are associated with excess fats and proteins and low-grade inflammation. We see these elevated with IBS and IBD as well, and the elevated Escherichia species is positively associated with the standard American diet. And last but not least, that last bacterium listed there, Akkermansia eosinophila, is lower. That bacteria really likes polyphenols. We know it's positively associated with metabolic homeostasis and weight loss, and so it's lower for this individual. When we look at the stool chemistries, because we want to understand the complex homeostasis of the microbiome, we can see that fecal secretory IgA is lower within normal limits, and that's at about the middle of the page there. Fecal secretory IgA precursors would be vitamin A, vitamin D, and zinc. We know that the standard American diet is low in these nutrients, so there's potential consideration there. As far as that pH is lower, we do see that. To address that, we're going to decrease dairy consumption and add soluble fiber. And then that low beta glucuronidase is not an actionable finding associated with the low diversity. So hopefully once you address microbiome diversity, that will improve. So what can we do to help this individual? First and foremost, we need to remediate that standard American diet. And the key nutrients here, sometimes it's a little easier to add things. So we need to add soluble fiber and add polyphenols. Adding fermented foods would really be helpful, and definitely just decrease fast food. That would be an easy thing to do. Avoid that. Consider the levels of vitamin A, vitamin D, and zinc, and appropriately supplement with those nutraceuticals and avoid dairy. So this man was actually very motivated, young individual, and he decided to switch to the paleo diet, right? And after 3 months, the fasting glucose is at 103. And for this individual, the key components were no more fast food, adding healthy protein, but no bun on those items, and adding in vegetables, but not too many vegetables, and eating some rice. So that's excellent. Let's take a look at this individual's microbiome. What we see here is a much improved microbiome. So take a look at that web. The web is actually about the same because actinobacteria is lower and Verruca microbiota is lower, but that proteobacteria is slightly improved. So the web does take a little bit of time to change, but we do know that we do see that dysbiosis has dramatically improved. So those bacteria that were associated with inflammation are decreasing. The microbiome is changing. Diversity score is 3, so that's about the same. But what we do note very healthy here is the GI health markers are within range. So the patient has improved the production of these really healthy bacteria that produce butyrate, support the gut barrier, provide health to the microbiome, and has decreased those inflammatory bacteria. Short-chain fatty acids, that valerate is there lower, but that's a really an incidental finding at this point, and beta-glucuronidase is still low. So really what you'd like to do is just continue adding vegetables and continue with the soluble fiber and polyphenols. The patient's really in the right direction here. So now, speaking of adding vegetables, we're going to switch over to a vegan diet. The vegan diet is characterized by a dietary choice that omits animal foods, including eggs and dairies. Now, with regards to research, there are some studies that show that plant-based diets are associated with a reduction in metabolic syndrome and cardiovascular disease and improvements in longevity. With these diets, there still are nutritional considerations such as B12, omega-3 fatty acids, vitamin D, supplementing with nutraceuticals may be warranted. And with these diets, as we'll see in this case, it is going to be an individual's choice whether they consider processed food part of their vegan diet. So let's take a look at this case. This is a 40-year-old female. And for breakfast, this individual is having cereal, boxed cereal with almond milk, granola bar snack. Lunch is pasta with red sauce and those cheese products, as well as the corn chicken nuggets, which is like a textured vegetable protein, and fries for dinner. Drinks include coffee, pop, and water. So technically vegan diet. When we take a look at this individual's microbiome, we see here that the actinobacteria and Verruca microbiota are lower and the proteobacteria are very high. So this is definitely a perturbed microbiome. Now, the individual, again, would need adequate sources of vegetables and polyphenols to support those populations, and then soluble fiber for the Firmicutes and the Bacteroides. Those proteobacteria, again, are inflammatory. The dysbiosis index score is moderate, and the diversity score is moderate as well. It's not a very diverse diet. Let's take a greater look at the metabolites here. Well, we see that the butyrate producing bacteria are too low. So what's going to happen is the individual will end up with lower butyrate and inflammation in the colon, but the other bacteria are within range. So for this individual, we see that elastase is lower and then that pH is too high. We do see some dysbiotic bacteria, Citrobacter and Enterobacter. It's a good thing that we found those because we can directly treat those and move on and help this individual. So for this individual, when we look at the cultured bacteria, we can see that there's no pathogenic bacteria such as Salmonella or Shigella, so that's a healthy finding. The imbalanced bacteria are within range. Now, these imbalanced bacteria are ubiquitous amongst GI physiology and our skin and our oral cavity, and sometimes we find them in the colon. So that's what we see there. But then we see this dysbiotic Citrobacter and Enterobacter, which can be associated with GI symptoms. We saw that pH there, so probably the patient is more prone to loose watery stools with these dysbiotic bacteria, and that's changing the pH. So those are too high and we'll treat those. The candida of note is within normal limits, and some candida within the microbiome is within normal limits. When we look at the stool chemistries for this patient, we see there's low elastase. Now that low elastase is due to low pancreatic function and enzyme production. So this is actually very common in individuals that are eating quickly, that don't sit down to chew their food, that don't smell their food before they eat it. But this individual is eating a lot of processed food. So cereal, right, that doesn't have a strong scent to it. The way that the body will secrete enzymes for digestion is when you smell your food. And that's a process. So we want to support that process, but you can also give elastase supplements here. And then that pH is definitely higher, but we want to add soluble fiber. We want to treat those dysbiotic bacteria. So how to help this individual? Certainly, we're going to address the dysbiotic bacteria. We need to still support those main phyla of bacteria. We need to add vegetables, we need to add polyphenols, and decrease processed food intake. So sometimes patients may be adhering to a vegan diet, but this might not be a healthy dietary choice for them. So these are the nuances to discuss with your patient and also show them the results, right? Because we do really want to support this microbiome. So we can supplement with low elastase and, of course, eating hygiene. So sit down when you're eating your food, chew your food, smell your food, have meals with others, avoid drive-throughs. All of that supports enzymatic secretion. For the low butyrate producing bacteria, we need to add soluble fiber at 8 to 15 grams per day. So this is roughly 1/2 to 1 cup of beans per day. And we'll get the details of that at the end. But it's very important to support these bacteria for this individual and remediate these vegan dietary choices. They can actually do all of this and still stay within their vegan diet. It's definitely possible to make these changes and keep within that dietary category if they choose. Our next diet, we're going to switch gears, is going to be a ketogenic diet. So this is the opposite almost of what we're talking about. The ketogenic diet has actually been around since 1920 as a treatment for refractory epilepsy. We do have some observations that this has been associated with weight loss, decreased A1C, and an increase in cholesterol and LDL cholesterol. So those observations are there. Of note, studies have shown that when children are given a ketogenic diet for epilepsy, that the microbiome of responders and non-responders does change. So this just lets us know that the response to a ketogenic diet for epilepsy may actually take root in the gut microbiome. So let's take a look at this patient. This is a 37-year-old male, and this individual is consuming yogurt and 4 eggs for breakfast with bunless burgers and bacon, a keto bar snack, popcorn, steak, and avocado, and olives for dinner, coffee with butter for breakfast, and then water is the beverage of choice. When we take a look at this microbiome, we can see that this web is low in abundance. So there's low beneficial bacteria here. We can see that visually. We can also see that diversity is off because it's really skewed toward those proteos, and the others are very low. So again, actinobacteria is lower. We need to add vegetables. Verruca microbiota is lower. We need to add polyphenols. Now, Bacteroides and Firmicutes are both lower, so definitely a need for soluble fiber here. The dysbiosis index is 4, so this is a dysbiotic gut, and the diversity score is 1. So this is a very low diverse microbiome. When we look at the GI health markers, we can see that every single GI health marker is outside the reference range. So that puts this individual at risk for inflammation in the colon, increased intestinal permeability, and that can subsequently increase many aspects of physiology once you have inflammation and intestinal permeability in the colon. The key findings we also note is that there's short-chain fatty acid imbalances. So we have a total short-chain fatty acids that are lower, which makes sense because the microbiome abundance is lower. And then we have a balance in the proportion of those. So short-chain fatty acid imbalance can potentially disrupt systemic physiology down the road. We do see a low beta glucuronidase, which is again incidental, and we have occult blood here, so we're going to talk about that. Additional findings would be cultured Klebsiella and Proteus. And as we mentioned here, we do have the findings of the GI health markers and the key findings here. When we take a detailed look actually at this patient's microbiome, we do see that the patient has low Akkermansia and high proteobacteria. So that is a key finding here. We definitely want to support the healthy Akkermansia, and we want to decrease these proteobacteria. Of note here, the patient does have positive occult blood. So occult blood positive is different than RBC finding. RBC is fresh blood. Occult blood is hemolyzed. It can be from the upper GI, such as esophageal varices or ulcer. In that case, you want to retest this in 4 weeks. If it's positive again, you retest again in 4 weeks, 3 positives, then you would refer for endoscopy. Now, in this case, though, we have observed that individuals that are consuming large amounts of red meat do have occult blood in their stool as an artifact. So I would certainly recommend retesting this in 4 weeks just to confirm. It will be a little tricky if the individual is on this diet because it will still be a little tricky to discern whether that's coming from red meat or from physiology. So you'd have to have them be off red meat for 4 weeks and retest. With regards to those dysbiotic bacteria, we can actually take those isolates in the laboratory and put them directly with these agents, natural and pharmaceutical agents. And so you can have individualized treatment for those dysbiotic bacteria. We definitely want to treat the Klebsiella and the Proteus. It could be associated with perturbed GI physiology, and we do see this sometimes with dysbiotic guts. How would we help this individual? So to help this individual, we are going to address the dysbiosis and diversity. So this individual is choosing this low carbohydrate ketogenic diet. We want to find foods within that category. So fermented foods, such as sauerkraut, may fit that category. We can add low carbohydrate foods such as berries, avocados, and lemons. The patient's already doing avocados, so that's great. Low carbohydrate vegetables. So this would be arugula, asparagus, bell peppers, broccoli, Brussels sprouts, cauliflower, kale, mushrooms, spinach, and tomatoes. So that's really important to add these low carb veggies. We're going to address the inflammatory bacteria. So decrease the consumption of processed foods such as bacon. And we want to support the butyrate producing bacteria via the soluble fiber feeding approach. And low carbohydrate options would be green beans or black soybeans. We need to address the gut barrier protective bacteria. So remember that Akkermansia was low. So you could use that in supplement form and or feed polyphenols to the individual. You could also support the gut barrier. I would certainly recommend your mucosal barrier protocol, whether that's L-glutamine, aloe. There's definitely nutraceuticals that can support the tight junctions and that barrier in addition to what you're doing with regards to the foundation of the microbiome. And then, like we mentioned, address that dysbiotic bacteria and retest the occult blood in 4 weeks. So our next case here is going to be the carnivore diet. And I know that you have patients in your clinic that are on this diet. It's very popular right now. So this is simply meat, fish, eggs, and some animal products, but excluding vegetables, fruits, legumes, nuts, and seeds. There's some individuals are going to be at 0 carbs per day. The peer-reviewed literature on this is sparse. I do believe there may be literature in new literature, but as of now, it's pretty sparse. But the personal stories are very strong. So individuals that are on this diet really do enjoy this diet, and we're seeing reported improvements in metabolic health, weight loss, food sensitivities, IBS, and autoimmunity. So some patients that have been diagnosed with IBS are using this diet on their own, and they may do that without telling you. So it's definitely something to be aware of, okay? And of course, improved energy. There's definitely some considerations here that individuals report positive outcomes. Considerations include the microbiome for this, mineral status, metabolic flexibility, and consider the confounding factors. This is the ultimate elimination diet. So I do wonder in individuals that have positive responses to the carnivore diet, what their microbiome looked like before they started and whether they or not they had intestinal permeability. For our next case, this is a 24-year-old male, and for breakfast, he's having 3 eggs with ghee and chicken or steak for breakfast, chicken or beef again for dinner, lamb or beef for dinner, bone broth throughout the day, coffee, black tea, and water. So when we take a look at this microbiome, no surprise here. And we see that web is definitely perturbed. It is not a healthy microbiome and abundance is lower. And we're low in these key phyla again. The dysbiosis index is 5. So that makes sense because when we're talking about the bacteria and the substrates that we need to support the bacteria, this diet is really devoid in those. And the diversity score for this individual is 1. So very low diversity. This is actually a dysbiotic microbiome. When we look at the GI health markers in detail, as we can see here, that the butyrate producers are outside the reference range, the gut protective bacteria are outside the reference range, and the intestinal health markers are outside the reference range. So that are going to be at risk for inflammation. So those healthy bacteria that prevent inflammation are not there. And then the pro-inflammatory bacteria are too high. And then again, you have this gut barrier protective versus opportunistic. So when we see the butyrate producing bacteria being too low, we want to add soluble fiber, 8 to 15 grams per day to support the bacteria. The gut barrier protective bacteria are too low, so we want to support those with what we're already doing, soluble fiber, but then adding polyphenols. And I would also consider your mucosal barrier protocol as well when you see that. The gut intestinal health markers are too low, so we definitely need to support that with soluble fiber. Inflammatory bacteria are too high, so that has a lot to do with the food that the patient is eating, so working through that detail. And then the gut barrier protective versus opportunistic, we know that's definitely at risk for inflammation and translocation. Now, as far as the key findings go, we see a red blood cell finding, we see muscle fibers and occult blood. I'm going to put those together here. So red blood cell, muscle fibers, and occult blood, this could all be due to excess dietary red meat consumption. The consistency is actually loose watery, which you will find very often in individuals choosing the carnivore diet, and then a short-chain fatty acid imbalance. As we mentioned, there's red blood cell, that's fresh blood. So it could be due to hemorrhoids, but it could be due to red meat. Muscle fibers are just too much red meat or mastication. So the patient needs to chew their food. And we have a loose consistency, which is actually common in this diet. So for this individual, we could consider cycling the carnivore diet. Individuals choosing the carnivore diet generally really do this diet. So we could consider cycling that and addressing the dysbiosis and diversity. So similar to the ketogenic diet, because we want to choose low carb options. So low carb fermented foods, low carb fruits, and low carb vegetables. It's important to get those in there. We can simply address the inflammatory bacteria by decreasing the processed meats and fatty meats. And of course, the carnivore cycling should help that. Adding the green beans or black soybeans for that soluble fiber component, and then again to support the gut barrier protocol and supporting Akkermansia populations. Again, with that red blood cell, that's definitely fresh blood versus the occult blood. You do the same thing. You want to recheck in 4 weeks. And of course, make sure the patient's avoiding red meat during that time. Okay. Our next case is a GLP-1 receptor agonist consideration. So GLP-1 receptor agonists are very popular right now. They exert multimodal effects, suppressing glucagon secretion and gluconeogenesis, may delay gastric emptying, stimulating satiety via the hypothalamic pituitary axis, the lipolysis, and stimulating insulin secretion. So the GLP-1 is actually a gut-derived peptide that, in the presence of polyphenol-specific bacteria such as Akkermansia, and in the presence of actually fiber and distension of the colon, and this will stimulate the release of the glucagon-like peptide in the colon. So there is important difference between the medication and endogenously secreted GLP-1 is the half-life. So the half-life of endogenously secreted GLP-1 is 2 minutes, while the medication has a 1 week long half-life. So that's the difference. So we definitely see popularity in these, and we may actually see some benefits the research is showing with regards to nervous system, cardiovascular health, metabolic health. This may be neuroprotective and cardiovascular protective. Let's take a look at this gut. So this gut is a patient that has been on the GLP-1 agonist for 3 years, denies weight loss, nutrient deficient. This individual is having a carbohydrate-rich diet with alcohol every night and not really eating during the day. So of note, that microbiome is very dysbiotic. You can see immediately that web is not a healthy web. It's very dysbiotic and it has very low diversity, okay? And then the GI health markers, we can see of note, the butyrate producing bacteria are too low. The one bacteria that's high is the gut barrier protective, and we'll talk about that, and low total short chain fatty acids and low butyrate. So those healthy short chain fatty acids are just too low, and this is a very dysbiotic gut. So the patient's not eating healthy, but that alcoholic consumption every single night definitely wreaks havoc on the gut microbiome. And as we see here, low butyrate and total short chain fatty acids. So for this patient, we do note that the patient has an elevated proteobacteria and Escherichia associated with excess fats and proteins and processed food. So they need to move away from those dietary choices, but that elevated Akkermansia eosinophila is a less common finding. So let's take a note about this. So elevated Akkermansia is actually observed with dysbiosis, as is low Akkermansia. So as many concepts within the gut microbiome, it's about balance. So some studies have shown that elevated Akkermansia has been observed in patients with multiple sclerosis. In theory, this may be a compensatory response. So that's the theory right now with elevated Akkermansia. There is an animal model in that elevated Akkermansia has been shown to eat the mucosal barrier when it's too high. We know that elevated Akkermansia is really important for the mucosal barrier. So that's why we want it in healthy populations within the human colon. Right now, there's no human studies to show that this is potential pathogenesis in human physiology, but we certainly want to support this bacteria in a healthy population. So for this individual, we have low butyrate and low total short chain fatty acids. We definitely want to support that with the food choices to support this and decrease subsequent inflammation. So for this individual, we definitely want to add diversity of produce, add the fermented foods to get the bacteria in the colon. You can also use probiotics. So for this patient, it's going to be a whole dietary overhaul starting from the very beginning because their pattern has been very unhealthy. So we'd use like an anti-inflammatory Mediterranean type diet that would be a good guideline and address the alcohol consumption. So again, a note about Akkermansia and GLP-1 because Akkermansia supports GLP-1 production, and it's interesting in this individual, but this individual has just been on that medication for too long without a positive health benefit. Generally speaking, for individuals, you can support dietary polyphenols and support Akkermansia, and that should go on to support healthy GLP-1 endogenous production. GABA also supports GLP-1 production. So again, we go back to having eating hygiene and eating in a parasympathetic state. Our next and last case here is a Mediterranean diet. So the Mediterranean diet is different. The key components here are going to be the emphasis of fruits and vegetables, emphasis of goat and sheep versus cow dairy, emphasis on fish, limited red meat. There is wine consumed regularly, so the red wine may have a polyphenol component. There's a lot of olive oil in this diet. It is about 1/2 cup of olive oil consumption per day, and there is a decreased risk of those non-communicable metabolic diseases. So here's our case. This is a 47-year-old female, and this individual is having breakfast with greens over olive oil, hummus, raw veggies. Snack is salmon with cooked veggies, chicken with chickpeas, and green for dinner. Drinks are going to be tea, water and red wine, 1 to 2 bowel movements per day, formed, no straining, denies gas, bloating, and enjoys walks and yoga and dinner with family on most nights. So no surprise here, this microbiome actually looks really healthy. It is a beautiful web there. The dysbiosis is 2, so this is healthy. Diversity is healthy. So this is actually a very healthy gut microbiome supported by those dietary choices. So what exactly is the details of the dietary choices? When we take a look at the gut microbiome needs and we take a look at these Mediterranean diet pyramid, we see that it's very supportive. So fruits and vegetables, that's going to support the fiber components, the insoluble fiber component, the polyphenol component, and then the soluble fiber component right there with beans. And then olive oil is actually very healthy for the gut microbiome. So this dietary pyramid actually feeds the microbiome. The last few slides here are going to be notes about these components to feed the microbiome. Olive oil is really important, and it is a huge component of the Mediterranean diet. So there is a concept out there that maybe the actual benefits to the Mediterranean diet are largely attributed to the large consumption of olive oil. Olive oil has actually been shown to increase gut microbiome diversity, increase butyrate production and short-chain fatty acid production, and of course that will go on to decrease inflammation and also improves fecal secretory GA production. Which diet is best? That was what we were talking about today. And as we can see, the components, there might not be a diet that's best, but when we talk about the microbiome, there's key components such as beans, greens for fiber, and berries, again, for polyphenols. So the beans and greens for the fiber component and berries for polyphenols. That's a good way to look at this. We also could consider decreasing processed food consumption, remediating seed oil consumption, seasonally rotating foods. And then there's a lot of talk in the United States about whether we're eating vegetarian or carnivore or over lacto-vegetarian. That actually might be a secondary question. The first question we should maybe ask is how many beans, greens, and berries are we eating? Here's a note for soluble fiber, because I said many times today that we need 8 to 15 grams of soluble fiber. So just to note that there is a difference between soluble and insoluble fiber. So insoluble fiber is that roughage that helps to stimulate a bowel movement. And then soluble fiber is the gelatinous component, and that's what the bacteria want as their food source, basically. So the soluble fiber supports these very healthy bacteria, these main bacteria in the human colon, such as Firmicutes, Clostridia, Lactobacillus, and the fecal bacterium Protenitzii, which they are really important in the human colon. And then they go on to secrete butyrate. Butyrate influences the colonocytes, inflammation, immune responses, mucosal barrier integrity. So all of this process works beautifully together. So 8 to 15 grams of soluble fiber, that's of the total grams, 30 fiber grams per day. Okay. And then polyphenols are really important. Polyphenols support Akkermansia and Lactobacillus in the gut microbiome. There's no recommended daily intake of polyphenols, but studies have shown that 1 to 2 grams per day is associated with the decreased risk of chronic disease. So in conclusion, we want to consider that food is medicine. There may not be one best diet, but it is important to look at an individual's gut microbiome and avoid these fad diets. So test and address the gut microbiome, look at the biomarkers that we talked about today, and remember, consider potentially greens, beans, and berries as we talk about the gut microbiome.
Welcome to Root the Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.